muscle, 1 centimeter in front. You're gonna go right there. That way you're grabbing the tail of the DAO. You can go a little bit more medial, but I wouldn't get too close. That way you don't hit the depressor labii. So that way when she smiles, smile, see, lip goes down. If you hit this muscle, this lip will be up like this, and she'll come back looking like this.
Let's not do that.
Okay? Then your only option is to even her out and paralyze this side so that her smile looks even. Okay? Or you wait till it wears off.
Very long 3 months.
And that can happen when you're injecting this muscle or the mentalis muscle. You can get a little diffusion, especially people who like to do a 2-point injection. They can get a little diffusion into that depressor labii muscle.
All right. So we'll do the glabella first.
So 22.
We're gonna go 30 to 20.
So my recommendation is to, when you're doing training, is to get as much hands-on as possible. And so
20 to 10 next.
a lot of the didactics is happening during the training and not, you know, sitting in front of a PowerPoint and then doing the injections after. And I think it's always nicer to do one-on-one training than group training, which is why I do one-on-ones. You learn more and you can focus more on the person's strengths and weaknesses and techniques and kind of help them perfect what they need.
Pressure a little bit. There we go. And then we're going to do the last 10 minutes here.
Let's go. Scrunch really hard for me. Okay, so lateral and medial. So I want to be a little bit more in the center if you're going to do a 1-point injection, so you can get like the bulk of the muscle. And it'll diffuse, remember. So Dysport actually diffuses a little further than Botox. So Botox, we say 1 to 1.5 centimeters around the injection point you're getting diffusion, and Dysport is more like 2 to 2.5 centimeters around. Especially the more you dilute, the more diffusion you get. So we talked about patients with big foreheads. You know, if you're diluting more, you're getting more spread, so you're catching kind of more lines there. Okay.
Now the frontalis. Okay, so we'll do about 20.
So you're going to do 10 on this side and 10 on this side? So split them up into about 3s, right? And I always do less in the lateral aspect and a little bit work my way more in the medial aspect, just because you're less likely to drop the brow or overcorrect. When you lift, you want to still have a nice arch if you can, and still have some movement, what kind of a natural look.
That's right.
Did you lose resistance? There you go. You felt the difference? You gotta lose resistance. Otherwise, it's a little more painful for the patient if you're not past that